Hello, hi guys. We have started ONCO series. We are here with a short video for all investigation of choices of certain diseases regarding to certain areas like oral, salivary glands, thyroids, breast. For everything, we have summarized investigation of choices into one place so that you can remember better. First, we will start with oral. For any oral glands or oral pathologies, you go for MRI. Like oral cancers, you go for MRI because it's a complex area with so many soft tissues involved. So you can go for MRI and it's easy to identify the oral pathologies in MRI. And then when come to glands like salivary glands and thyroid glands, in salivary glands they are glands, right? So for glands you go for FNAC, right? So for salivary gland and thyroid gland you go for FNAC, whatever may be the pathologies like goiters in thyroids and some cysts in something, everything related to thyroid you go for FNAC, except if it's a follicular adenoma versus follicular carcinoma, you can't differentiate them in FNAC. So go for histopathology. It's the most important bit asked many times. Follicular adenoma and carcinoma, how you will differentiate by histopathology, not by FNAC. In thyroid, there are three pathologies which you have to do true cut biopsy. Those three pathologies are lymphoma, riddle, anaplastic carcinoma. Until then, I'll revise once. Oral, you go for MRI. Salivary glands and thyroids, you go for FNAC. In thyroid, for differentiating adenoma, follicular adenoma and follicular carcinoma, you go for histopathology. And in thyroid, if it's lymphoma or Riddle's thyroiditis or anaplastic carcinoma, you go for true cut biopsy. Now, along with this three thyroid diseases, lymphoma, Riddle thyroiditis and anaplastic carcinoma, breast and prostate, breast in females, prostate in males, soft tissue sarcoma, for these three cancers, you go for true cut biopsy. For this thyroid three diseases, breast, soft tissue sarcoma and prostate, you go for true cut. In prostate, you go for transrectal ultrasound guided true cut biopsy. Finally, it is a true cut, but you go through transrectal ultrasound guidance. So here to summarize, thyroid three diseases: breast, prostate, soft tissue sarcoma, true cut. And now comes to renal. Almost all pathologies in renal, CECT is the investigation of choice. Almost all pathologies. And for the bladder, I have to go through cystoscope. You have to scope the bladder, and you can go for whatever investigation you want. If it is a cancer, you go for a cystoscopy and histopathology. So to summarize, all renal, you go for CECT, investigation of choice. All renal pathologies, not only cancers, many renal pathologies, the investigation of choice is CECT. All bladder pathologies, the investigation of choice is cystoscopy. Next, here comes testis and penis. Testis, never do biopsy, because if you do biopsy, you will stage the cancer into the next level. Okay, you will lodge the cells somewhere else. You will metastasize the cancer while doing a biopsy. So never biopsy in testis carcinomas, only ultrasound. And then in penis carcinoma, you go for biopsy. Got it? Testis, never biopsy, it's an ultrasound. Penis, biopsy, always biopsy, penis cancer. Then there come to GI tract. All GI cancers, you go for endoscopy and biopsy. It's so common. You put a tube inside, you take a biopsy of it, and you'll examine. Except GIST, DLBCL, and carcinoid syndrome. In GIST, you go for CACT. In DLBCL, you go for PET-CT. In carcinoid, you go for urine 5-HIAA amount. Urine 5-HIAA, you will calculate. To localize the carcinoid, you go for CACT. Finally, to summarize, all GI cancers, you go for endoscopy and biopsy. Except GIST and carcinoid, you go for CACT. DLBCL, you go for PET-CT. But if he asks the investigation of choice for carcinoid, you put urine 5-HIAA before CACT. If he asked radiological investigation of choice, you go for CACT. So to clear the controversy, everything endoscopy and biopsy, GIST, carcinoid, CACT, radiological, carcinoid normal, urine 5-HIAA, DLBCL, PET-CT. And here comes the HCC, pancreas, gallbladder, and bile duct. All these cancers, you need high level investigations, except carcinoma bladder. Carcinoma bladder, ultrasound is enough. Ultrasound is enough to identify the carcinoma bladder. So investigation of choice is ultrasound. And for HCC and pancreas, you go for triple phase CT, right? You go for triple phase CT. For HCC and pancreas, you go for triple phase CT. This is very important investigation. You remember, very hot topic for examiners. They'll ask, what is the investigation of choice regarding HCC and pancreatic cancer? If we have to put triple phase CT. For cholangio cancer, that is MRCP. MRI plus MRCP. That's it, how you identify the cholangiocarcinoma. These are the basic cancers and basic pathologies. You can grossly answer the questions by remembering these investigation of choices. Investigation of choice is one of the important area for the exams, but he'll ask clinically these days. He'll give a clinical picture regard for one cancer, and he'll ask finally a simple question of investigation of choice. That's it, guys. Enjoy this investigation of choice. Enjoy ONCO series. Keep following our content. Please like, share, and subscribe our channel in YouTube. Thank you.